My name is Dr. Root.
Okay, just tell me a little bit about your background, especially your education, where, when, what you did after dental school that led you to where you are.
Well, I started all my education in the United States. I lived there for 12 years. Did my dental school in Philadelphia, Temple University. That's the second oldest dental school in the United States. After 4 years of dental degree, dental school, then I did my postdoctoral at University of Alabama in Birmingham. That's when I study and specialize in prosthodontics.
And how long were you in the States for?
I was there in total, including college, for 12 years.
Okay,
So I lived in 3 different time zones altogether. Started out on the West Coast in Seattle, then I moved east to Philadelphia, and then central in Birmingham.
And when did you come back to Bangkok full time?
Came back in '94, and as soon as I came back, I joined Thai University. As soon as I came back, I joined Chulalongkorn University, which is considered one of the best dental school here. I took the position of a lecturer, full-time lecturer at that school. I stayed there for 10 years. I started a program at the master level in the field of implant dentistry. Actually, I wrote the curriculum.
Wow.
Because having fully trained in the United States at that time with my specialty is a rare thing in this country. So when they wanted to start the master program in prosthodontics, well, they asked me to write the curriculum for implant dentistry. And I get a lot of joy out of that because it's a great opportunity. And at that time when I started teaching, I felt that the opportunity that I was given was unique, and certainly if I bring some of my knowledge and some of my skill to the Thai dental community, it would be very beneficial to them and to the general population as a whole. That's why I stayed for 10 years.
Oh, okay. And so when did you start the DDS clinic?
We started 5 years ago when I quit teaching.
Okay. And who's with you in the DDS clinic?
I have 3 partners. Dr. Chiraiporn, who's an endodontist, Dr. Patraporn, who's a general practitioner, Dr. Ketsarin, who's a board-certified diplomat of American Association of Periodontics. So she's actually the one placing implants. So she's also one of those dentists in this country with a very rare qualification, because she also spent 15 years in the States doing what she does, getting dental education, practice, and taught in the United States, and now she's with us as partner, helping us placing implants.
There's a lot of experience in your clinic.
A lot of experience. A lot of our associates had international education background. So in a way, it is very, very good that we have this kind of people working with us.
Mm-hmm. And so do you offer all dental treatments in your clinic?
We offer all dental treatments, from general work, fillings, cleaning, to more advanced treatment such as implants, aesthetic dentistry where we place a lot of veneers, smile makeovers, that sort of things. So it's a wide range of treatment that we offer.
It's a little bit different in Australia because in Australia when you see a dentist, if you need certain treatments you have to go to another facility for it, but that's the advantage here is that everything can be done in your clinic, just in one clinic.
In one facility, because we have all specialty working with us.
Right, so somebody can come here for their first appointment and they don't have to travel to anywhere else. It's all done here for x-rays, etc.
Right. Mm-hmm. So when they come here, most of the time I would be the first person they would meet. And if there's particular special need for that patient, I would make sure that proper referral is made. But yeah, it will be done in our facility.
Mm-hmm. Okay, as a Medi Makeovers client back in Australia, what would you expect them to give you so that you can give them a almost complete assessment? So what would you like to receive from them?
More information never hurts. So whatever they feel that they can give me that will be useful in terms of assessing their dental treatment, I would appreciate. But yes, whether it's going to be description, of what they want, of what they need, the more we get, the better it is that we have a better understanding of what they want. Crucial things would be, of course, photograph. We can take a look and make some kind of assessment out of those kind of information. What's really helpful would be x-rays.
What type of x-rays do you really need?
OPGs.
So the 3D OPGs?
If they want implants, CT scan would be very beneficial, because if you get the CT scan, there's no surprises.
Yeah.
We know exactly the dimension of the bone. We know exactly the volume of the bone. We know exactly what type and what size of implant could be placed.
Because you really do, well, the whole thing is to really give them the best assessment before they come over, so there's no shocks or any sort of price outlays that they don't understand. So getting the best information to you is obviously the best thing to do.
It's beneficial for them. Mm-hmm. I can do a better assessment of the type of treatment that they require, judging and receiving more information.
Okay, so obviously a lot of people are scared of dentists. They've obviously had something maybe as a
There's
child.
No need for that.
Well, you'd be amazed. There's a lot of people that have a fear of dentistry.
Right.
So I'm sure you've seen many patients like that. So how do you...
Every day.
Yeah, exactly, every day. So how do you overcome this fear for patients?
Actually, let me just say this. Pretty much everyone who walked into our office has some kind of fear, has some kind of discomfort, bad memories about previous treatment, about their previous experience of dentistry, but so much has changed, And the way that we approach our patient is basically we give them all the information that they need. A lot of times when people know what we're doing, it puts their mind at ease. For example, when we give injections, simple injection, we will tell them, okay, this is going to hurt a bit. And when we say it's going to hurt a bit, we're not just saying it. Because before we place any needle, before we do any injection, we put topical anesthesia on their gum. So the type of needle that is used nowadays, it's very fine, triple bevel, silicone coated. So just the technology alone makes it a lot easier for the patient. But as far as interaction, like you and I sitting here, how do I put you at ease when you want to be my patient? It's from talking, it's from communication, it's from understanding of why we have to do certain things.
Any distractions like music or maybe some medication if it's
if
a
you like to watch a video on our screen, we
Sure.
have a screen for the patient to watch. Music, it's up to them what type of music they want. For example, I had requests for classical, blues. The only thing we hadn't played for them is heavy metal rock.
Heavy punk rock. That's understandable. That's good.
Since most of my patients are my age, so it's
Yeah.
quite easy actually,
Yeah.
because we play, music from the 80s. It's quite okay as far as atmosphere is concerned. If you look around here, nothing screams out clinic.
Yes, it's beautiful.
It's very relaxed.
Beautiful, relaxed, yeah. I guess just looking at your demeanour now, you're quite a relaxed type of guy, so that can put people at ease too. So, and me meeting your other staff as well, they're all very professional, but also very relaxed, very friendly, very smiling. So that helps. That helps. But so just a little side thing. So have you been to Australia?
Twice.
Twice? Where have you been?
I've been to Perth,
Right.
Fremantle.
You
Love
planning
the
any new
place.
trips?
I'm going there next year in March. Sydney for the first time.
Yeah.
I want to see Sydney Opera House.
Mm-hmm.
I've seen kangaroos, so.
So obviously now you're getting a lot of our patients, so the Medi Makeovers clients, the majority are Australian.
Right.
So I guess we have to get you a kangaroo for your little room and put
Wombat.
it up. A wombat, yeah, we'll do that. We'll do that.
Right.
So, well, thanks very much, and we're looking
pleasure.
forward to you helping our clients from Medi Makeovers and making them feel more comfortable and just helping them with their dental treatments.
Fantastic.
Thanks very much.
Thank you.